offer that we feel is the best that can be achieved at this stage through negotiation. If the offer is accepted, then it would meet a key GMB demand of a huge pay uplift for the lowest paid to keep them well above the real living wage. Progress has also been made on non-pay demands, such as addressing violence in the workplace. This offer is far from perfect, and of course our NHS workers deserve more. Of GMB's National Committee is recommending that the offer be accepted, but the final decision belongs to the members. Strike action will be paused until the outcome of the ballot. So that the very latest from Rachel Harrison there, and the key line to take away is that strike action will be paused pending that ballot. Well, let's bring in our correspondent Matthew Thompson, who's at Union headquarters in central London for us. So that's the update that we were looking for. And Rachel Harrison there, positive that a deal is almost completed.
It certainly seems that way. In fact, a deal looks as though it's been done, at least with the government and the various unions involved, a total of 14 unions involved in the negotiations, but with the caveat that Rachel Harrison was just outlining there, which is that this is only to be recommended to the members themselves, and ultimately each union's members are the ones who will have their final say. It will be put to a members' ballot. But just in the last few seconds now, we have a statement, a joint statement, in fact, from the government themselves and from the NHS Staff Council, which is the umbrella group for those unions I was mentioning a moment ago. And they said that the government and the NHS Staff Council have completed negotiations and reached a final offer. This includes additional pay for 2022-23 and a pay settlement for 2023-24. So that's in line with what we've been reporting through the day. We think a pay offer of something in the region of 5% going forward, and then a one-off payment of something like 6%. But presumably now that we have the deal done, we'll get the full details of exactly what it entails. But the statement goes on. Both sides believe it represents a fair and reasonable settlement that acknowledges the dedication of NHS staff while acknowledging the wider economic pressures currently facing the UK. Those unions with mandates for industrial action, so that's the Royal College of Nurses, Unison, the GMB, the Chartered Society of Physiotherapists, Unite and the BDA, will now consult their members in consultations that will be held over the coming weeks. And importantly, as you rightly say, strike action will continue to be paused whilst these ballots are ongoing. So as I say, it looks as though we're there. Finally, after, well, a week and a half or so of fairly intense negotiations, a deal has been agreed. But with the important caveat that that doesn't mean we're out of the woods, because this then goes back to the members who ultimately have the final say. Just two other things worth pointing out is that, yes, this potentially brings an end to the rolling strikes that have plagued the NHS for a number of months now, but importantly, doctors are not included in these negotiations. So the junior doctor strikes that we had this week, for example, are not affected. And actually the British Medical Association, the union representing junior doctors, has put out a statement a very short time ago saying that they're now inviting Stephen Barclay, the Health Secretary, to sit down with them tomorrow to try and hash out a deal of their own. The second thing worth pointing out is at the moment, and potentially this will become clear as the afternoon goes on, we're not entirely sure where the money to fund this is going to come from. There was no new money in the budget yesterday. Certainly possible that the one-off payment could be paid for via the Treasury reserves, a reserve payment for extra spending of around £14 billion that the Treasury has this financial year. But in terms of where they afford the 5% pay rise on an ongoing basis from, well, that's not entirely clear. And if it comes from NHS budgets, well, that might be a problem of its very own making.
Matthew, thank you very much for that update. And staying across that story, well, let's bring in our chief political correspondent now, John Craig, who is in Westminster for us. So we know strike action paused, but what's the reaction from the government, John?
Well, you've heard that statement from Matthew there, that that negotiations have been completed and there's been a final offer. Well, how many times do we hear in industrial disputes that it's the final offer from the employers? We shall see. But you have to say, listening to that GMB statement, that they seem minded to recommend to their members to accept the offer. Now, that's only one union. On the based on the experience of the last few weeks, the Unite Union, which is one of the 3 unions representing ambulance crews, has been more militant, if you like, or more determined to pursue a better deal. And it's entirely possible you could have one union backing the deal and another, like Unite, for example, not backing it. Clearly, the GMB is minded to accept the offer. At one point, a few weeks ago, the government was attempting what was described by union leaders as a divide and rule, trying to buy off the Royal College of Nursing, traditionally, obviously, a much more moderate and less militant union than the others, the nurses, as opposed to the ambulance crews. And as Matthew rightly says, there's still a pretty ugly dispute going on involving the junior doctors, whose leaders claim that a junior doctor starts on less money than a barista in a coffee shop. So there's not much movement there. And of course, there's no movement yet on teachers either, and various other disputes, and not obviously government employers, but the rail unions and indeed Royal Mail. So this is certainly, the government will see this as a breakthrough. Now, as to where the money's coming from, there is nothing in the documents or any of the small print that we saw yesterday from the budget earmarked for this. And the Chancellor didn't mention these strikes. But of course, what ministers have been very concerned about in recent weeks, of course, is that as they do try and push for growth and the economic growth, and the Chancellor called it a budget for growth, what is one of the things that really holds back growth, of course, is industrial actions, a loss of productivity. And of course, in the terms of the National Health Service, one of the Prime Minister's 5 aims is getting waiting lists down, and health bosses have been telling the government till they're blue in the face, the employers, how can we cut waiting lists when our staff are on strike all the time, or many of them are on strike? And there has been a mood amongst NHS bosses, trusts, employers, organisations, really piling pressure on the government to settle these disputes with, first of all, the nurses and secondly, the ambulance crews, because it has been doing enormous damage to the National Health Service and indeed really crippling the government's attempts to get waiting lists down. So, been massive pressure on the Chancellor and indeed Mr Barclay, the Health Secretary. They clearly have made an improved offer, but whilst the GMB seem to be saying to their members, we think it's a good deal, at this stage, we haven't heard that from the other unions yet, as far as I know. Let me just double check. Here I have, yeah, now that's, I think this is this is the Royal College of Nursing, I think. Yeah, yeah, in addition to a commitment from the Royal College of Nursing, the government's agreed to new pay for all nursing staff. This looks like an offer to nurses, right? So there appears to be an offer to nurses as well, a one-off payment for the current financial year between £1,655 and nearly 3,800, and 5% for next year. So there seems to be an improved offer to nurses as well here. So we are looking at offers to 2 key groups of workers in the National Health Service, the ambulance crews and the nurses. So we will see what the response is. Obviously, the GMB, who've talked in terms of perhaps recommending to their members to accept this. Of course, it has to go to a ballot. That's probably going to take a couple of weeks. But because the unions are pausing further industrial action, the government will be hopeful that this is an end to these very damaging disputes. But, of course, there are several groups of workers and several trade unions here, so we shouldn't assume that these strikes are over yet and that there is a deal yet. These offers have to be put to the members, and whilst they are a big improvement, really, on, at one point, the government was talking about 3.5%. That was going back towards the back end of last year. It's a big improvement, but it's still nowhere near what the unions have been asking for. For example, the Royal College of Nursing started off by asking for 19%. Then Pat Cullen, a few months ago, said, OK, we might consider half of that, say 10%. Well, this These offers are still short of that. So it is entirely possible that they may be rejected. But of course, if the unions do recommend accepting them, well, that will be a boost for the government and could bring about the end of these very damaging disputes. So we await some words perhaps from Mr. Barclay, the Health Secretary, who has been holding talks over the last few days. We await also words from other trade unions involved here. But just to recap, the GMB, one of the major unions representing ambulance workers, ambulance crews, does seem to be recommending that it is the best offer they can expect to get.
Yes, John, we do wait to hear from Stephen Barclay, but I wonder if you could give me your assessment thus far as to how damaging this whole episode has been for the government.
Well, massively. As I've mentioned, one of Rishi Sunak's 5 priorities is to get waiting lists down. And we know that the NHS employers have been pleading with the government to come up with more money, saying, how can we get waiting lists down when the staff are on strike, whether it's the nurses or whether it's the ambulance crews. We've seen shocking figures of the time people are waiting for ambulances. We've heard shocking stories. Every week in Prime Minister's Questions, MPs on the opposition benches get up and raise stories of people waiting hours, having treatment cancelled and so on. And clearly, the Prime Minister has presumably banged some heads together. We know that the Prime Minister is on a bit of a, he would see it as being on a bit of a roll at the moment, trying to solve a lot of very difficult problems. We started off with the Northern Ireland Protocol. Then, of course, we had the legislation on the small boats. Then we had the budget yesterday. And, of course, whilst there was nothing yesterday from the Chancellor, it does seem that here we are 24 hours or so after the budget.
John?
The Prime Minister and the government are trying to solve this problem.
John, I'm just going to cut in there because we can bring Steve Barclay, the very latest comments on that deal that we believe has been reached.
Well, the government's made a formal offer to the NHS Staff Council that I've just come out of a meeting with them. I'm very pleased that they've agreed to recommend to their members. It will be for a 5% pay rise next year, 2023-24, but also an additional lump sum in terms of this year, which is additional to the award through the pay review body, which was on average 4.75%. And then what that will mean, for example, for a newly qualified nurse is over 1,800 this year on top of that PRB award and a pay rise of over £1,300 next year. And obviously that increases for more senior nurses in higher grades.
Now, of course, some of that money for this year is a one-off payment, which means it doesn't go long-term into the salaries of those people. You've said frequently that you wouldn't look at this year's pay. Why didn't you do this earlier?
Well, we have listened to the concerns of the trade unions. We've had meaningful discussions with them. Both sides have engaged constructively. Obviously, the starting position from the number of the unions was much higher, and so both sides have worked together to reach a settlement which is both affordable to the wider taxpayer and balances the very real pressures we recognise that NHS workers have been on. So this balance was required on both sides. That is what the talks explored, and that's why I very much welcome that we've reached a settlement with the NHS Staff Council that balances our commitment in government to get inflation down, to look at the cost and what was affordable to the wider economy, to taxpayers, but that also recognised the very real pressures that NHS staff had faced through the pandemic and particularly through the recent winter.
So an important question, how much is it going to cost and how will it be funded?
Well, we've been clear that it will not come at the expense of impact on patients. Obviously, how these things are funded are a matter for the Chancellor, and we discussed that within government. But we've been
He hasn't offered any new money. He didn't in the budget.
We've been very clear in terms of the conditions of the discussions we had with the trade unions that this will not come from patient-facing aspects. Of course, we will look at areas of underspend, areas of administrative saving, and discuss these things with the Treasury in the usual way. But the commitment is one that the trade unions have recognised is meaningful. It reflects very constructive engagement with them. It means there will be a lump sum additional for NHS staff this year, recognising the pressures, and a 5% settlement for next year.
The funding thing isn't important, though. There are hospital trusts who are very concerned that even if some of this has to come out of existing budgets, it's going to mean more pain for patients.
Well, we're being clear that as part of the discussions we had, this would not come from areas of the budget that impact on patients. So those was part of the terms of the discussions that we had. That was the nature of the negotiation, and that was part of the mandate I received from the Prime Minister and from the Chancellor.
There are many people, though, who will look at this and say this dispute has been going on for months. There was talk of a one-off payment several weeks ago, months ago, in fact. Were you blocked from doing that and pursuing that by the Treasury?
Well, we take decisions cross-government. These things are entered into collectively. Of course, part of my job as the Health and Social Care Secretary is to advocate for the NHS within government in exactly the same way that the Education Secretary will do so for teachers or the Transport Secretary for train drivers. My job is to make the case for the NHS within government. Of course, that is something that I have been doing over recent months, but we make these decisions collectively. I'm very pleased we've reached a settlement which the NHS Staff Council feel able to recommend to their members. It balances our commitment to get inflation down, to guard the interests of the taxpayer, but does so in a balanced way that also reflects the very real pressures that the NHS has been under over recent years.
But you've been forced to the negotiating table, haven't you, by the strike action? And for those people who've had operations and treatment cancelled, postponed potentially for months or years, they're going to say you should have done something sooner.
Well, there's been significant movement in terms of what the trade unions were originally asking for. For example, one of the trade unions originally was suggesting a 19% settlement. So there's been movement on all sides.
They moved some time ago, though, didn't they?
Well, not to the position that we are on today. So there's been further constructive engagement. We've had intensive talks over many days. There's been movement on both sides, and that reflects the balanced nature of the settlement we've reached, looking after the interests of taxpayers, getting inflation down, but recognising the real pressures that the NHS has faced.
And just finally, I know you'll be pleased, of course, that you seem to have reached an agreement here, but junior doctors, this doesn't include junior doctors, does it?
No, and my door is open. I look forward to having discussions with them. Clearly, we entered the talks with the Agenda for Change trade unions on the basis of them suspending their strikes, respecting the engagement principles. I welcome the leadership that the trade unions have shown in those discussions. We've had discussions that have respected the confidentiality throughout. Both sides have been willing to work in a very constructive way, and I hope the junior doctors will take note of that and reflect that in their approach over the coming weeks.
And your message to them is they need to suspend strike action, is that right?
Yes, that's the principles which the other trade unions accepted, the RCN, Unite, Unison, the GMB, all respected that. We've offered the same terms to the junior doctors that were accepted by those other trade unions, and that's what I hope the junior doctors will respond to. But a request from them for a pay rise of 35% is not affordable. That's why we need to see from them the same sort of leadership that we've seen from the trade unions in the Agenda for Change contract.
Well, the latest from Stephen Barclay, the Health Secretary there, on the agreement with the unions over a pay deal, paving the way for an end to the industrial action. I want to bring in our correspondent, Matthew Thompson, who's with the GMB in central London for us. So we heard the Health Secretary there. Matthew, update us on what the union's saying.
Well, the deal is now done, at least as far as it can be. It's very much now in the ball being passed now to the union memberships, if you like, because ultimately they're the ones who will have the say on this. The union bosses can only recommend the deal, and ultimately it has to be accepted by the membership. But for the time being, there is an agreement, finally, after a week or so of fairly intense negotiations by all accounts between the government and the unions. And who better to update us on those negotiations than Sarah Gorton, the head of health at Unison and the chair of the NHS unions. You've been locked behind closed doors with the Health Secretary for some considerable time now. Are you pleased with the result?
Well, the offer that is on the table today was hard won by health workers. So, you've been covering the strike since December. So it's taken several months of disruption to the public services in the NHS. Members have lost money, and health workers have been resolute, and that's resulted in an offer coming forward. Whether it is good enough, will, as you said, will rest with the health workers themselves. But the elected committees in Unison, in GMB, in the BDA, the CSP, the Royal College of Nursing, have voted today to recommend the deal as the best that can be achieved through negotiation.
So that's an interesting caveat, because what I was going to ask you is this, in your view, a good deal or just the best deal that was achievable under the circumstances?
I think, you always take these things in context, don't you? I mean, it would have been better if we'd had this level of investment put in the health service this time last year, because then we wouldn't have faced a situation where so many people left to go and work for better paid and less stressful jobs elsewhere. That said, we've got an increase of 6% of the pay bill, which is not an insignificant amount of money, and hopefully might go some way to addressing people's cost of living pressures and, help employers retain staff throughout what's going to be a really busy summer.
You rightly say this obviously has to go to the memberships, who will ultimately decide. But would the memberships, looking at this, a 5.2% pay rise, would they rightly be disappointed, given that at least one union, the Royal College of Nurses, started off wanting 19%? Quite a lot lower.
Well, the joint trade unions aimed to get close to inflation. We wanted an inflation-busting pay increase. What we've got, if you're adding consolidated increases from last year with a lump sum, which is very, very crude maths, but broadly the investment is over 10% on the pay bill. Which, if it had happened at times when people were facing their stiff bills, then that would have been considerably more helpful. So it is a decent sum of money. I have done my level best to give members a credible choice, so health workers can now decide between taking further strike action and picking up an offer. I know that me and other trade unions work together to engage with the government and press for as much money as we could, as much additional investment. The lump sum payments that health staff would receive if they were to pick this offer up range from a minimum of £1,600, just over £1,600 at the bottom of the pay scale. Most people at the top of Band 5, so Band 5 is where most of the registered occupations, so occupational therapists, nurses, physiotherapists, dietitians, where they come in, and it will be £2,000 for those people, so a not inconsiderable sum of money. And because we've been able to negotiate now for the pay rise for the following pay year, people would have the security of knowing that was in their pay packets early and applicable from the 1st of April, rather than waiting and crossing their fingers to see what comes out of the pay review body in the summer.
Given that there is now an offer on the table, an improved offer, and for all those reasons you outlined, and given the disruption that this has, by your union's own admission, caused to the health service, is there now more of a more pressure, more of a moral obligation on staff to accept this and go back to work?
Well, I'd say the moral obligation was all on the Secretary of State. All we said right from the start was that we would rather have had the opportunity to talk rather than take industrial action. All of the paramedics, the nurses, the healthcare assistants, the cleaners, the whole team of the NHS who you've spoken to during the course of this dispute, all of them will have told you that they would rather have their unions in rooms negotiating to get them an improved offer than taking action. We consistently asked for talks the whole way through this dispute. This has been hard won. Members deserve to have a choice. The public deserves to have a health service that has better investment. So trade unions today are pleased that we have the opportunity to give them that choice.
Sarah Gorton, Head of Health at Unison, thank you very much indeed. So there we have it, the view from the unions, but it is ultimately, as I said, over to the memberships, and also some outstanding questions about where this money actually comes from. There was no extra money in the budget yesterday for this. The Health Secretary, you heard him in a clip a short time ago, suggesting that it wasn't going to come from NHS pay pots, for example, but that wasn't necessarily or pay pots, NHS budgets, but that's not a complete ruling out the possibility that it comes from somewhere else in the NHS. And the issue with that is, if there's no new money from the central government in the budget, well, then it's got to come from somewhere within the health spending envelope. So that potentially creates further problems somewhere down the line for someone else to resolve.
That is the future question to ask for the moment, though. Thank you, Matthew. Well, if you are just joining us, a potential major breakthrough has been announced that could end many of the strikes heaping pressure on the NHS. Unions representing staff, including nurses, ambulance drivers and physios, but not junior doctors, have reached a pay offer with the government and have paused their industrial action while they put it to members. Well, NHS staff would receive a 5% pay rise for the next financial year, starting from April. Health workers would also receive 2 one-off bonuses for this year. One of those would be a COVID recovery bonus, which will range from 1.5% for the highest paid and 6.2% for the lowest. The offer covers all NHS staff, including nurses, paramedics, 999 call handlers, but it doesn't include doctors, as I said. Well, let's bring in our chief political correspondent, John Craig, who's in Westminster. A deal seemingly struck, John, but not quite over the line just yet.
Well, of course, the unions may be at least 2 of the unions that we've heard from are recommending that it's a good deal or the best they can get. Let me bring you some words from the Prime Minister. Rishi Sunak has said, "I'm really pleased that after several weeks of constructive talks, the government and the Agenda for Change unions have come to an agreement that will provide a fair deal for NHS staff and put disruptive strike action behind us." Mr Sunak says it's right that we reward our hard-working NHS staff who showed bravery and dedication throughout the pandemic and continue to make phenomenal progress to tackle waiting lists. Importantly, this deal is also affordable for the taxpayer and continues to deliver on my promise to halve inflation. We've taken a reasonable approach throughout, and this offer is good for NHS staff, it's good for the taxpayer. Most importantly, it's good news for patients whose care will no longer be disrupted by strike action. Well, Mr Sunak there is saying it's affordable for the taxpayer, and of course he talks about his target. One of his 5 priorities is getting inflation down. Well, obviously he's had one eye on that, but also getting waiting lists down. That is one of his priorities, and it's one of the things that NHS bosses have been really knocking on the government's door and saying, please come up with some money to solve these disputes, because how can we get waiting lists down when our staff are on strike so many days over the past few months. Now, speaking a short time ago, Steve Barclay, the Health Secretary, when he was asked where the money's going to come from, he said, well, it's not going to come out of the budget for treatment of patients and so on. He also significantly said he had been making the case within government for this cash. So clearly there's been a lot of pressure on both the Prime Minister and the Chancellor, Jeremy Hunt, to come up with this cash. This extra cash. This was what Mr Barclay was saying just a very short time ago about what appears to be a very significant breakthrough.
Well, the government's made a formal offer to the NHS Staff Council that I've just come out of a meeting with them. I'm very pleased that they've agreed to recommend to their members. It will be for a 5% pay rise next year, 2023-24, but also an additional lump sum in terms of this year, which is additional to the award through the pay review body, which was on average 4.75%. And then what that will mean, for example, for a newly qualified nurse is over 1,800 this year on top of that PRB award, and a pay rise of over £1,300 next year. And obviously that increases for more senior nurses in higher grades.
Now, of course, some of that money for this year is a one-off payment, which means it doesn't go long-term into the salaries of those people. You've said frequently that you wouldn't look at this year's pay. Why didn't you do this earlier?
Well, we have listened to the concerns of the trade unions. We've had meaningful discussions with them. Both sides have engaged constructively. Obviously, the starting position from the number of the unions was much higher, and so both sides have worked together to reach a settlement which is both affordable to the wider taxpayer and balances the very real pressures we recognise that NHS workers have been on. So this balance was required on both sides. That is what the talks explored, and that's why I very much welcome that we've reached a settlement with the NHS Staff Council that balances our commitment in government to get inflation down, to look at the cost and what was affordable to the wider economy, to taxpayers, but that also recognised the very real pressures that NHS staff had faced through the pandemic and particularly through the recent winter.
So Mr Barclay was then asked how much is it going to cost and how will it be funded. His answer was, we've been clear it will not come at the expense of impact on patients. How these things are funded are a matter for the Chancellor, and we discussed that within government. So that was the response to that question from Mr Barclay. I can now bring you a response from Steve Brine. He's the Conservative MP who chairs the Health and Social Care Select Committee in the House of Commons. Mr Brine says the news of a breakthrough pay offer to NHS workers is a good outcome for patients and staff. I hope it'll provide a solid basis for pay settlements going forward. For anyone who's been affected by cancelled appointments and longer waits, this has been a difficult time. Tackling the backlog is a priority for the NHS that will take all the efforts and hard work of the staff upon which our services depend. So he obviously is hoping the unions will back this. Mr Brine is a long-time ally of Jeremy Hunt, the Chancellor, going back to when he was one of Mr Hunt's junior ministers when Mr Hunt was Health Secretary. So clearly they found the money from somewhere. The Chancellor's found the money. Slightly odd that he didn't say yesterday when we were all listening and MPs were all listening to the budget statement, and I can announce that I've found some money for the NHS staff. But obviously the negotiations were clearly at a delicate stage then, and that's why we've had to wait 24 hours. I should just say, actually, we've heard quite approving reaction from the GMB and the Unison trade unions. I should just say we await news from Unite, because their General Secretary Sharon Graham has taken, one might say, a more hardline approach. And if one union is not going to accept this, it would probably be Unite. We also haven't heard yet from Pat Cullen, the General Secretary of the Royal College of Nursing. Now, as we know, the RCN was originally demanding, as Mr Barclay I think said just a moment ago, 19% at one point. Then Pat Cullen said, well, actually, we'd settle for half of that. What's being offered here is nothing like half of that. And so it's always the possibility that the unions will reject these offers of the one-off payment and the pay rise. It's a very legitimate question, and no doubt the government's political opponents will say this could have been settled ages ago, because the whole idea of a one-off payment was floated a couple of months ago now, in the early part of this year, January from memory. And at that point, it did appear that the Treasury was blocking that. So clearly there's been a pretty big change of heart at the very top of government, both in the Treasury and in Number 10. And clearly the government has taken the view they really have got to bring these disputes to an end. So the government, you can say perhaps the government has blinked first here, because they've improved their offer. It is the biggest breakthrough we've had in this whole dispute, but we await the reaction from a couple of the other major trade unions, and but clearly the government, both the Prime Minister, the Health Secretary and indeed senior MPs like the Chairman of the Health Select Committee, they are very much hoping that the unions will back this offer and bring to an end these ruinous strikes, which have been really damaging for the NHS, both in terms of waiting lists and, as we've heard, from cancelled operations and real misery for many, many patients.
John, thank you. John Craig there with the line from the government. Let's see what the unions have to say. We'll bring in our correspondent, Matthew Thompson, who's in central London for us. Matthew.
Well, John mentioned there a number of unions, the RCN and the GMB, and we hadn't heard, in fact, from Pat Cullen, who's the head of the Royal College of Nurses, who'd been one of the harder line negotiators. We have now heard from Pat Cullen, almost as he was speaking. She says that she now feels vindicated for the pressure that the Royal College of Nurses and others were able to put the government under. She admits that it's not a panacea to the problems, but it's a significant deal. And she's urging members to accept it, although they understand why members may not want to. And you've got to think, perhaps, for particularly Royal College of Nurses members who were at one stage being told that their union was advocating for a 19% pay rise, well, they might feel a little bit shortchanged. But let's see what happens in the coming weeks. We also have a statement from the GMB union. Rachel Harrison, the National Secretary, said in a rather lengthy statement, but I hope you'll bear with me, thanks to the strength and hard work of GMB's NHS members, the government has gone from refusing to talk about pay this year to putting an extra £2.5 billion on the table. GMB members, she said, should rightly be proud of themselves. It's been a tough road, but they've faced down the Department of Health and won an offer that we feel is the best that can be achieved at this stage through negotiation. If the offer is accepted, then it would meet a key GMB demand of a huge pay uplift for the lowest pay to keep them well above the real living wage. Progress, she continued, has also been made on non-pay demands, such as addressing violence in the workplace. This offer is far from perfect, and of course our NHS workers deserve more. GMB's National Committee is recommending that the offer be accepted, but the final decision belongs to our members. And then importantly, they finish by saying strike action will be paused until the outcome of the ballot. And I think what's very interesting about the tone generally from the unions, we heard from Sarah Gorton from Unison, who I interviewed a moment ago, certainly from the GMB, from the Royal College of Nurses as well, is it's almost a cautious recommendation. It's almost like they're accepting that they didn't quite get what they want. They're not coming out saying this is the best deal, you know, we're so delighted with this deal. Even there in that GMB statement, they said, well, we actually think health workers deserve more. But what the settled view appears to be, both on the record and speaking to union sources off the record, is that they've come to the realisation, if you like, that this was the best deal that they were going to get, at least without doing another 6 months of strike action with all the moral quandaries that would entail. So it's a cautious recommendation from the unions, but fundamentally it's over to the members to decide.
OK, Matthew, thank you very much for the moment. Just to bring some breaking news on this story, an update. We're hearing that Unite are rejecting the offer. That's the very latest. Unite Union rejecting that offer from the government of the 5% pay rise, additional lump sum and the one-off payment. John Craig is in Westminster. Back so soon, John. We were just talking about whether all the unions would sign into this, and Unite saying no.
Gillian, I can bring you a statement from Unite. This is from Sharon Graham, the General Secretary. She says, it's clear that the government has been forced into negotiations. It's clear that the government has been forced into negotiations and the subsequent move because of strike action and the support of the public for the NHS. She says, the offer from government is not one that Unite can recommend to our members, but ultimately it's important that our members make the final decision. Unite will support members in whichever decision they now make. As Unite members are being consulted, strike action will be paused. So I think I was speculating a few moments ago that if one of the unions was going to reject this, it probably would be Unite. So that is a statement from Sharon Graham. She says that they can't recommend it, but the final decision is for the members. They'll support their members, whatever decision, but they are also pausing their strike action. So Unite is saying no, but it's up to their members to decide.
OK, John, thank you very much for that update. Well, let's get some reaction now to the pay offer with one of the nurses that has been striking, Antonia Berylson. Antonia, thanks very much for speaking to us. Just to say up front, obviously, you're an RCN member. What is your first inclination, to vote for this increased pay offer or not?
My first inclination is incredible disappointment, really. It's a derisory offer, and it's not keeping up with the cost of inflation, and the rank and file membership are pretty perturbed by it, to be honest.
We've just broken the news that Unite are not going to advise their members to vote for this. You are in agreement with that thought?
I am indeed. And I mean, we all voted for industrial action with very heavy heart because none of us nurses wanted to, but we're struggling with the cost of living, bills are going up, and our pay is just not keeping up. But don't forget, it's been over 12 years of below inflation pay rises. So essentially, we're asking to come to terms with the fact that we have been having a pay loss for many, many years. We're seeing hemorrhaging experienced staff are leaving, and we're not recruiting the nurses, and this pay offer is simply not good enough.
Pat Cullen has said that she feels vindicated for putting pressure on government to get to this stage, and she's urging members to accept the offer. Originally started at 19%. That was the initial call from the RCN, whittled down to 5%. Will you then disregard Pat Cullen's call to accept what has now been offered?
Gillian, you know, it is a union led by members, and us as members, we're really, really struggling. You know, just today, a nurse spoke to me how he can't afford to fill his prescription for his own health because of the wages he's getting, and he's a band 8, which is a high band. It's simply not good enough. You know, during COVID, we lost our colleagues. You know, I sat by the bedsides of people in inadequate PPE. This is all about political choices. And it's simply not good enough because, you know, as a nurse, I'm absolutely passionate and I want the NHS to continue. I want there to be staff. I want nursing to be a valued profession. It's a university. We're university-educated professionals. And yet we're having to think whether or not we will put the heating on. You know, question, you know, I'm a single parent struggling to pay my bills, and this will not. It's a start, but it's simply the pay offer is not good enough.
Antonio, I can see that you're very passionate about this and getting a little emotional, but you will say that this is no way near what you should have. What figure are you thinking of?
What I'm thinking of, that what we need for first start, we're looking at pay restoration. We're looking at over 12 years of below inflation pay rise. We need to have a pay offer that meets inflation for the very least. Not to mention the fact that they are offering a one-off deal, which will affect many nurses are on universal credit, so this one-off payment will affect them. We need to ensure that we are having an adequate pay deal that is above inflation. And just don't forget that due to higher than expected tax receipts, the government announced not so long ago they've got 30 billion. The money is there, and it is all about political choices. You know, we need to ensure the NHS continues because the NHS is one of our greatest institutions, and we need a healthy working population that ensures that we need to cut waiting lists. We need to ensure that people are having their appointments, but the only way to do it is simply to get the staff in. And unless we have the pay that reflects the role we do, unless we have the pay that reflects the fact that when COVID happened, nobody could doubt our integrity. We were there on the front line. You know, we're breaking bad news. We're doing the roles that junior doctors did many years ago, and our pay simply does not reflect that responsibility and the hours unpaid, not to mention. You know, we need to make this an attractive profession to ensure that we can meet the demands of an increasing ageing population.
The government suggests that they are allaying some of the fears that you've raised. It's a 5% pay rise for the next financial year. There'd also be 2 one-off bonuses for this year. And one of those would be a COVID recovery bonus. You were mentioning the situation during the pandemic, and that will range from 1.5% for the highest paid and 6.2% for the lowest. And this covers all NHS staff, including nurses and paramedics and 999 call handlers. That still does not meet what you think you require.
No, it's inadequate and it's too late. You know, COVID, we've had years and years of below inflation pay rise. It's not enough. And the fact that we had to wait for so long to even start to have a pay offer, it's not good enough. And the members are definitely, you know, perturbed by the level of the offer. We deserve more, for sure.
Antonia Barrison, thank you very much for speaking to us this afternoon, a nurse who has been involved in strike action as part of the dispute. Let's take a look at the rest of the day's news now for you. And ministers have banned the Chinese-owned social media app TikTok from all UK government phones. TikTok has been under increasing scrutiny over its security and data privacy, with concerns it could be used to promote pro-Beijing views and gather user data. TikTok denies the claims and says it's disappointed by the UK's decision.
As many colleagues will know, social media apps collect and store huge amounts of user data, including contacts, user content and geolocation data. On